What are some of the best practices for implementing universal screening for substance use disorders? Or should we be implementing universal screenings for substance use disorders?
I think at
Yeah, I
this
think
table,
we've all-
most
right.
of us are saying
Right.
yes.
Screen everyone.
Yeah.
Why would you screen everyone?
I think and you have to screen everyone multiple times, right? Because at some point they might be open and honest with you. Because you can't look at someone and say they're not using alcohol, they're not using cocaine. So just assume that people are going to be honest, and when you ask, they'll say.
It also would be destigmatizing to some extent if everyone expected it
Right.
and didn't see it as somehow an assessment of their competency or their self-worth.
Right.
It just is.
I ask everyone.
Yeah, and as long as you have a unified, easy way to ask people,
Right.
then it makes it easy, right? But if you have to ask 15 questions to get at whether a patient's using substances, that makes it really challenging. So making it universal, making it easy, and just implementing it into your workflow, whether that's through an electronic health reminder or having other members of your team be the screeners, thinking about ways in your system to make sure that universal screening is happening.
How close are we to that? Let me ask you guys as patients. Were you asked about your substance use the last time you went to your general practitioner for your annual physical? I wasn't.
No.
I always get asked about smoking, and I get asked about heavy drinking. I don't get asked about other substances.
I got asked, "You don't drink, do you?"
Well, sometimes it's asked in that way.
Which is, which
I mean, they knew what I do for a living, so that might have been part of it, but I said, actually, I do. So.
We've kind of talked about, we agree that universal screening, but in which settings is this most appropriate?
I ask all my patients in my private practice, at least when they start treatment with me, and ask them fairly often afterwards, though not every time I see them, but and depending on the patient. And some patients might ask every time I see them.
I really was trying to think of a place where this wouldn't be appropriate. And I mean, it's even appropriate for physical therapy, right? It's appropriate pre-surgery. It's appropriate for inpatients. It's appropriate for outpatients. It's
Seems like it's absolutely essential.
emergency rooms. I couldn't really come up with a place, and so it just kind of really reiterated that universal screening is, no matter what field you go into, you're going to have patients who use substances, and we should be screening.
And you may do things that could increase their risk if they're using substances, right? So
That's right.
dentists, really any healthcare system. That's not to say that it has to happen with every contact point, but you have to have a flow of how you're gonna get that information. And again, I think if we want to be agents of culture change, if we make it universal and people expect it when they come in, we start taking away at that stigma that I think is it's been such a prominent feature of every module in this course that we talk about a huge barrier for our patients. And so we really do need to create culture change, and that's one way to do it.
for other problems like HIV and hepatitis C, we've created an algorithm to decide how often people should be tested. For people at high risk, it's every year. For people who are in certain age groups, it's it's at least once, and then once every 5 years. For people in other groups, it's once ever. Do we have a similar algorithm for screening for substance use disorders, or should we need to develop one as a community?
I think it would be
That's a great
useful to
question.
develop
Yeah.
one. I think with where we are with the opiate epidemic, I think everyone's on heightened awareness, and you won't be faulted for asking at this point, right? But I certainly think that it's something we need to consider if it really does, if it is too much of a burden on the healthcare system to be asking. then we should have guidelines developed on how to do it.
You're not, are you asking, or are you asking about screening?
Asking about how often we should screen.
Screen. Like through urine.
No, I mean
Okay,
asking about it. I
asking
mean,
questions.
Or every.
Evaluation.
I don't mean testing people to make
Right.
sure that I'm opposed, for obvious reasons, to any kind of coercive
Right.
testing of people's bodily fluids.
Yes.
You're saying we should do that in primary care? No.